Hello everyone, happy evening, a very good evening. I hope and I believe all of you are doing well. A quick nod everyone. Am I audible and visible everyone? Yes, am I audible and visible everyone? Great. So here we are into a short sprint session where we will be discussing biochemistry, the most important points in biochemistry. This is like, just a part of the entire short content, the short and the extra edge content that we have on MedSynapse app by Dr. Nikita. So I've handpicked the most important areas which are volatile, which need tricks to be remembered and which are frequently asked in the exam. So this is definitely, what you have to know and revise before the exam. And the biochemistry test is also live in the MedSynapse app in the free course, short sprint course, right? Please give the test. Like I've always told you, give the test before the session and give it after the session, maybe a day later, to see that how much of what you have learned do you retain, right? So you can give the test twice. Okay, so you can give before the session and you can re-attempt it after the session as well. All right. So let's start with discussing the most important topics in biochemistry. First one, cellular compartmentalization and metabolic fuels. So the metabolic pathways, which metabolic pathways occur in cytosol, which occur in mitochondria, and which occur in both cytosol and mitochondria. So what is the trick for that? The short subscribers, what is the trick to remember this? Cytosol में क्या होता है? Remember synthesis, the majority of the synthesis, they occur in cytosol. How do you remember that is? Synthesis, write it as CY to remember that majority of the synthesis occur in cytosol. Okay. So remember, the synthesis is mainly cytosolic, synthesis of cholesterol, proteins, fatty acids, nucleotides, but not what synthesis does not occur in the cytosol but occurs in the mitochondria? Yes, absolutely, sir. This will help you very, very much for your upcoming FMG exam. You will definitely get questions out of this in your upcoming FMG exam. Okay, so remember which synthesis does not occur in the cytosol is ketone body, ketogenesis. It occurs in the mitochondria. Remember, ketogenesis actually takes place when? In the fed state or fasting state? In the fasting state, right? So it is like catabolic. So they occur in the mitochondria. Okay, so synthesis cytosol. Also remember HMP shunt also occurs in the cytosol. Glycolysis. So remember HMP shunt, glycolysis, they are occurring in cytosol. So these two cycles are very, very important for RBCs. RBCs do not have any organelle, right? So they rely entirely on glucose, glycolysis occurring in cytosol, and HMP pathway. What important compound coming from HMP shunt is important for these RBCs? To maintain the RBCs, to protect the RBCs from the oxidative stress, free radical injury. What compound is it? Yes? It is NADH or NADPH. Please remember it is NADPH, not NADH. And remember in HMP shunt, there is no ATP. RBCs का ATP आता है glycolysis से और NADPH is important to cater to this oxidative stress. Very good, Manshi. Correct. Okay. Now going to ketogenesis and fatty acid, what oxidation? Beta oxidation. Where does it occur? It occurs in the mitochondria. Okay, that is in the mitochondria. Beta oxidation, which is the most common in mitochondria, and you have ketogenesis. What synthesis occurs in the mitochondria is ketogenesis. Next one, both compartments. What is the mnemonic for that? Hug, right? We hug with both the arms. So remember, cytosol and mitochondria both is hug. What does H stand for? Please remember, H is not for HMP. H is for heme synthesis. Is something which occurs in both cytosol and mitochondria. So can it occur in RBCs, heme synthesis? No, because RBCs do not have any organelles, no mitochondria. U for urea cycle, the urea synthesis. And what is G for, guys? What is G for? In both cytosol and mitochondria, what does this G stand for? Glycolysis, glycogenolysis, gluconeogenesis, or it is glycogenesis. What does the G in the hug mnemonic stand for? Yes, very good. It is gluconeogenesis. Okay, gluconeogenesis. The G is for gluconeogenesis, not glycolysis or glycogenolysis. Going to metabolic fuels, what uses glucose, fatty acids, ketone bodies? So remember, brain normally uses what? Glucose, right? But when there is prolonged starvation, it switches to using what? Does it use fatty acids? Remember, fatty acids cannot cross the blood-brain barrier. So it does not use fatty acids, but yes, it uses ketone bodies, which are like acetoacetate and beta-hydroxybutyrate. It uses ketone bodies. Okay, clear with everyone? Ketone bodies are synthesized in the liver, but liver cannot use ketone bodies because of the deficiency of previously asked question. Liver produces, it is a factory for ketone bodies, but it cannot use ketone bodies because of the deficiency of the enzyme thiophorase. Okay, the enzyme is thiophorase. Going to cardiac muscle. Cardiac muscle is unique in a way that it continues to use what as a fuel even during the well-fed state. It is not using glucose. Majority of the organs use glucose. What does muscle, the heart, use cardiac muscle? It is fatty acid. Okay, remember it is fatty acid. So cardiac Ca is AC. Remember it is fatty acids is what it uses. RBCs exclusively rely on glycolysis, that is glucose, right? So via anaerobic glycolysis, because they have no mitochondria, they cannot use anything else. Okay, done with this. Going to lipid wala part, the enzymes and regulation in the lipid metabolism. Tell me what is the answer for this one. This is the rate limiting enzyme for cholesterol synthesis. Remember cholesterol, cholesterol is CoA. What CoA? HMG CoA. Synthase or HMG CoA reductase. Is it HMG CoA synthase or reductase? Remember, it is HMG CoA reductase because that is what is the drug. Statins, they reduce the cholesterol by acting on HMG CoA reductase. That is how you can remember. So remember, this is HMG CoA reductase. HMG CoA reductase. Okay? And it is naturally inhibited by bile acids. Very good. Next one. This enzyme hydrolyzes triglycerides in the adipocytes during the fasting state. So it is hydrolyzing triglyceride fat. So it is lipase. Tell me what lipase is it? HSL or LPL? Hormone sensitive lipase or lipoprotein lipase? Yes, Dhanush, very good. We have discussed all those 15 cycles ke rate limiting enzymes with all the tricks in the MedSynapse Sure Shot, right? So HMG CoA synthase is for ketone body synthesis. Correct, Dhanush. ये वाला कौन सा है? This is HSL, hormone sensitive lipase. Okay. Remember, HSL is what comes activated in the fasting state, and it is activated by these hormones, not insulin. Because remember that insulin increases activity of which lipase, LPL or HSL? The mnemonic is insulin. L for L. Insulin loves LPL. H for H. Insulin hates HSL. Right, so insulin will increase the activity of LPL, it will decrease the activity of HSL. So when I say insulin is loving LPL, insulin comes in what state? Fed state, right? After the meals, you have insulin coming in. So fed state में आएगा LPL, fasting state में आएगा HSL. Fed state में आएगा insulin, fasting में आएगा ये glucagon और epinephrine. ठीक है? So this is acting via what pathway? The cyclic AMP pathway. Going to next enzyme, it hydrolyzes the triglycerides in chylomicrons and VLDL. What are chylomicrons and VLDL? Lipoproteins. So it is breaking down the lipoproteins ka triglycerides. So this enzyme is going to be LPL, lipoprotein lipase. So it is acting in what state? Fed state. It is stimulated by insulin. Remember, insulin loves LPL. Very important, tell me that LPL activity requires what apoprotein as a cofactor? Apo B48, B100 or A1 or some other apoprotein is required for LPL. Very, very important. Correct, Inderjeet Kaur. It is Apo C2. Remember, it requires Apo C2 as the cofactor. This Apo C2 is present here on chylomicrons VLDL में भी आएगा. ठीक है? Is this clear with everyone? And where is this lipoprotein lipase enzyme present? Is it present in the adipose tissue? HSL is present in the adipose tissue. Where is this lipoprotein lipase functional? In the blood, in the capillaries. So that is why it is called as functional enzyme, active in the blood itself, not in any tissue, but in the blood, in the capillaries. Okay. Going to next one. What apoprotein is uniquely found on chylomicrons? Yes. So chylomicrons, basically they are from the diet. So dietary triglycerides maximum होते हैं, exogenous dietary triglycerides chylomicrons में. It is Apo B48. Very good. It is Apo B48. And what comes from the liver wale lipoproteins like VLDL, IDL, LDL? It is Apo B100. Okay, it is Apo B100 coming on the VLDL, IDL and LDL. B48 is for chylomicrons. Okay. Coming to this one, tell me what is this disorder, the lipid disorder which has steatorrhea, retinitis pigmentosa, acanthocytosis and fat soluble vitamin deficiency. Right? It is acanthocytosis, retinitis pigmentosa, steatorrhea, and that is why there is fat soluble vitamin deficiency because fat is not getting absorbed. What is this disorder here? Very good, correct, Dhanush Heman. This is A beta lipoproteinemia. Okay, this is A beta lipoproteinemia. Remember A for A. It has acanthocytosis, not echinocyte, but acanthocytosis is seen in A beta lipoprotein. A मतलब absent, beta lipoprotein मतलब जो बी एपो बी वाले हैं B48, B100 एपो वाले लाइपोप्रोटीन्स वो नहीं होंगे. वेयर इज द डिफेक्ट? Very good, Inderjeet. It is MTP, the MTTP gene or MTP defect, which is microsomal triglyceride transfer protein, MTTP, MTP. Okay, so that is where is the defect in MTP is what you have in A beta lipoproteinemia. Is this clear with everyone? Right? Going to next one, type 2 dyslipidemia, which is hypercholesterolemia, is a defect in. Remember, whenever you talk about cholesterol, it is like bad cholesterol, LDL cholesterol. So that is LDL. Cholesterol is rich LDL. Okay, so this is a defect in the LDL receptor. Okay, this is a defect in LDL receptor. So the LDL is very high. You know that LDL is a bad cholesterol. It will lead to atherosclerosis. And tell me what xanthomas will you see here? Palmar eruptive xanthoma, tendon xanthoma. What xanthoma do you see here? So remember, this is type 2. 2 matlab do matlab tendon. Okay, remember do, that is tendon xanthoma is what you have in hypercholesterolemia. It is tendon xanthoma, Achilles tendon commonly affected. Okay, tendon xanthoma, very, very important. Okay, remember we have learned all these tricks. So, do is tendon xanthoma, and then you have atherosclerosis. Going to next one. Give me a quick thumbs up if this is clear with everyone so far. Is this clear with everyone? Yes. Coming to electron transport chain and ATP production, the very, very important topic, ETC complexes, complex 1, 2, 3, 4, 5, right? So remember, rotenone, phenobarbital ending in ONE1. So they inhibit complex 1. Okay, remember rotenone, phenobarbital, right? It is complex 1. Succinate dehydrogenase is basically, succinate is second complex, SCSC, succinate second, It is complex 2. And remember what inhibits this complex 2? Basically succinate dehydrogenase. What is the mnemonic? MS Dhoni, MSD, right? So MSD, succinate dehydrogenase, is inhibited by M wala compound, which is malonate, okay, which is malonate. So remember MSD. We have learned the mnemonic MSD is an iron man. So this requires iron, succinate dehydrogenase. Okay? Right. Going to next one, remember antimycin, write it as N3-mycin. It inhibits complex 3. Okay, that is complex 3. Then you have complex 4 is all the ides. So you have cyanide, carbon monoxide, hydrogen sulfide, sodium azide, but not, which ide does not come here? This is also a PYQ. कार्बन डाइऑक्साइड नहीं आता, नाइट्रिक ऑक्साइड नहीं आता. ठीक है? Okay, so complex 4 is what oxidase? Cytochrome C oxidase. It is cytochrome C oxidase. Did we see in physiology sprint yesterday? Cyanide toxicity. What happens to SaO2, PaO2 and the total oxygen content? Yes, let me see how much of that do you remember? Yes, can somebody tell me? In cyanide toxicity, how is, we have seen this in physiology sprint. Correct. It's histotoxic hypoxia. The defect is at the level of tissues. Everything in the blood is normal. PaO2, SaO2, total oxygen content, everything is normal. Malini, if you have not seen physiology sprint, please watch that. ठीक है, सब कुछ नॉर्मल होता है. It is the tissues. Like I've given you an example. I'm giving you everything on your plate. If you are not eating it, right, the problem is at the receptive end. बाकी तो प्लेट में सब कुछ नॉर्मल है, तो ब्लड में सब कुछ नॉर्मल है. ठीक है, it's all normal. Very good. Going to next one, which complex is the ATP synthase? It is complex 5, which has F0 and F1 subcomplex. So the one which is towards the matrix side is the actual which synthesizes the ATP. And then you have the F0 subcomplex, जो transmembrane proton channel है, basically वो F0 है, and it is blocked by oligomycin and venturicidin. Remember oligomycin, oligo मतलब decreases the proton gradient, right, and thereafter it decreases the energy to synthesize ATP. Okay, venturicidin, remember V is like number 5, so venturicidin is complex 5 inhibitor. Oligomycin is also your complex 5 inhibitor. Have we learned 8-tractyloside in Sure Shot? Yes, the Sure Shot subscribers, what was the trick for that? 8-tractyloside, ATRA, ADP ATP transporter को जो inhibit करता है वो है 8-tractyloside. ठीक है? Going to uncoupler is 2,4-dinitrophenol, a physiological uncoupler. Is it found in the body? No. Remember, it's a chemical uncoupler. This is also a question asked. It is synthetic chemical, right? It is not in the body. Which is the physiological uncoupler, guys? Which is the physiological one? Which is found in brown adipose tissues. So, which is present in obese people, small children, and that is why a lot of heat production occurs. Right, obese people feel a lot of heat because of this uncoupler physiological, which is thermogenin. The term itself tells you thermogenin, heat generating. So remember, what do the uncouplers do? They increase the heat production. Why? Because basically ATP is not formed. They are dissociating electron transport and ATP production. So ATP is not formed. So this energy which is coming from the electron transport chain is converted to heat, right? So they abolish the proton gradient, they increase the heat production, and respiration is what they increase. That is, the ETC is what they increase, but there is no ATP synthesis. The ETC increases, but then there is no ATP synthesis. Okay, is this clear with everyone? Going to ATP. ATP yield, what compound enters at complex 1? Is it NADH or FADH2? So in the electron transport chain, basically from the various cycles, you have NADH, FADH2, which are formed. They go into the electron transport chain and then they form the ATP. So out of this, which one enters at complex 1 and which one enters at complex 2? Remember, it is complex 1. Remember, 1 has N in it. It is NADH. So it is NADH. Because it is entering first, it gives more ATP, which is 2.5 ATP. While you have FADH2 gives 1.5 ATP because it enters at complex 2, not at the complex 1. So the proton gradient generated is less. So the ATP produced is also less. Okay? So 2.5 and 1.5. Remember, 1 में N आता है. So NADH is at complex 1. Okay? A quick thumbs up, guys, before we go on to the next topic so that I know that this is clear with everyone. Yes? Coming to very, very important part in biochemistry, which is amino acid derivatives, amino acid disorders, glycogen storage disorders, right? All the disorders, basically, very, very important. Okay, so urea cycle, the rate limiting enzyme is carbamoyl phosphate synthetase, CPS1 or CPS2. What is the rate limiting for urea cycle? CPS1 or CPS2. Remember, it has urea, right? All the A. A is the first alphabet. It is CPS1. Okay, it is CPS1. 1 is the mighty number. Rank 1 is like the mighty rank. So remember, mitochondria, number 1 mighty, CPS1 is mitochondrial, CPS2 is cytosolic. Okay. It requires what as an allosteric activator? NAG, N-acetyl glutamate is what is required for activation of this CPS1. Is this clear with everyone? I've also told you the trick in short ki AA में are the amino acids which are required for urea cycle. What are those 2A wale amino acids? Yes. You have arginine and aspartate. Okay, arginine and aspartate. Going to next one. So which amino acid is important for synthesizing nitric oxide? Very, very important. Very important. Remember, it is arginine. Okay, it is arginine is nitric oxide. Okay, arginine is for nitric oxide. Okay, nitric oxide acts via what second messenger? Yesterday we had seen the mnemonic GANE. So N was there. Remember, it is cyclic GMP. It acts via cyclic GMP. Which amino acid synthesizes vitamin B3? So remember, 3 is tri. Tri is tryptophan. Tryptophan. So remember, the answer here is going to be tryptophan. Remember, trypto has TO, so it synthesizes seroto. And what other compound? Is it melanin or melatonin? Please remember, it is melatonin. Okay? Trypto is melato, not melanin. From where does the melanin come? Remember, melanin is black color. Black color is tire. So, melanin, black tire. It is tyrosine. So, what synthesizes melanin is black tire. It is going to be tyrosine. Okay, it's going to be tyrosine synthesizes melanin. Okay, and remember that tyrosine is rhyming with thyroxine. So, thyroxine is also from tyrosine. Thyroxine, right? A lot of like sympathetic activity wala. Remember catecholamines, dopamine, norepinephrine, epinephrine, ये सब भी आता है from tyrosine. Okay, is this clear with everyone? We have learned the reactions which take place in the process. What do you need for conversion of dopamine to norepinephrine and norepinephrine to epinephrine? All of this has been discussed in short with the tricks, right? I'm not going into details of that. Going to metabolic disorders, amino acid. Tell me, what metabolic disorder is this? The patient has blonde hair, blue eyes, microcephaly, and musty or mousy odor. Musty, mousy odor is what disorder? Remember, F is for M and M is for F. So musty mousy odor is seen in F, phenylketonuria. Phonetically F, phenylketonuria. And fishy odor is seen in, what is M for? Trimethylamine. Okay, F is for M, M is for F. So remember that musty mousy odor is F wala, phenylketonuria has this odor. So in phenylketonuria, what amino acid becomes an essential amino acid? What amino acid becomes essential? The enzyme deficient is phenylalanine hydroxylase. Okay? So that converts phenylalanine to tyrosine. But when this is blocked, tyrosine cannot be formed. So we have to take tyrosine from the diet. So remember, tyrosine becomes essential. Otherwise, normally tyrosine is non-essential amino acid. Going to next one, accumulation of homogentisic acid, ochronosis, black urine upon standing, and arthritis. Very, very important, black urine upon standing. Remember, black urine is kala, black is kala in Hindi. Kala urine is A-L-K-A. Kala, rearrange the alphabets, it becomes alka. So remember, where do you have kala urine is? Alkaptonuria. Alkaptonuria, what is the deficiency? Homogentisate oxidase. That is why homogentisic acid is accumulating. Remember, A for A, arthritis, early onset arthritis is alkaptonuria. Plus there is ochronosis, the cartilage pigmentation. Okay, pinna वगैरह cartilage pigmentation होगा. Okay, correct. Going to homocysteinuria. Do you guys remember the trick to remember what vitamin deficiencies can cause homocysteinuria? क्लासिकल होमोसिस्टीन्यूरिया. अगर एक विटामिन आपको चूज करना है तो कौन सा विटामिन डेफिशिएंसी है होमोसिस्टीन्यूरिया? यस, वेरी गुड, करेक्ट. It is not B12, guys. It is not B12. It is B6. Remember, it has homocysteine. Is homocysteine. Okay, so that is vitamin B6 deficiency, classical one. The other vitamins are multiples of 3, but not 3. 6, 9, 12. Okay, remember it's vitamin B6, B9, and B12. Out of that, 6 is the classical one. Multiples of 3, but not 3. So what amino acid do you supplement and what amino acid do you restrict in homocysteinuria? Correct. Remember, phonetically, supplement cysteine, SS. So you supplement cysteine. And what do you restrict? Mat-do. Remember, mat-do is like methionine. You restrict methionine and you supplement cysteine. Very, very important. Right? Clinically, homocysteinuria can be similar to Marfan's in case that the patient is a tall patient with lens subluxation. But how do you differentiate it from Marfan's? What is the direction of lens subluxation in homocysteinuria? Remember, cysteine is in. It is in and down. Okay? So in Marfan's, remember, how do you remember for Marfan? Where is the fan present? Up. You say fan up and fan out. Everybody fan out. So fan is up and out. Opposite of that, down and in is homocysteinuria. Okay, so down and in, that is inferonasal, is homocysteinuria. Okay, and is there intellectual disability in homocysteinuria? Yes. Okay, that is also present. Is this clear with everyone? Okay. राइट, प्लस आएगा पेशेंट में, यंग एज में एमआई हो रहा है, स्ट्रोक हो रहा है, यू शुड थिंक ऑफ homocysteinuria. ओके, so that was about amino acid. Important, the most important, like the bare minimum amino acid derivatives and disorders that you should know. We have not discussed about Sigawa syndrome. We have not discussed about किसमें होता है शुगर वाला ऑर्डर, burnt caramel, maple syrup, urine disease, उसमें कौन से amino acids, क्या enzyme, right? All that, the details have been discussed in Sure Shot course, so please revise from there. Okay? Going to carbohydrate metabolism and enzyme kinetics. Fluoride inhibits what enzyme in glycolysis? Remember E, F, G. Enolase inhibited by fluoride, and this is what cycle? Glycolysis. So remember, it inhibits enolase. So that is why you use this fluoride in what vacutainer? The one which is used for glucose. ग्लूकोज के लिए कौन सा है? रिमेंबर जी फॉर जी, इट इज ग्रे कलर. ग्रे कलर वैक्यूटेनर में होता है फ्लोराइड एंड ऑक्सलेट. ओके, going to enzyme kinematics, competitive versus non-competitive. What example I've given you for this? The example of playing musical chair, right? So last chair है, दो लोग हैं competing for the same chair. That is going to be competitive inhibition. Okay, that's going to be competitive inhibition. So they are competing for the same site, which is the active site. ठीक है? Is this clear with everyone? So remember, when I write competitive, write it as competitive. That is how you write. So remember, KMII is increasing. So in competitive, Km increases. Remember, Km is inversely related to affinity. So affinity is decreasing. The other one remains the same. The Vmax remains the same. When you have the Lineweaver-Burke plot, what do you have in competitive inhibition? Remember, C for C. Crossing line is what you would see in competitive inhibition. So you would have the crossing line in the competitive inhibition. They are crossing at what axis? The lines are crossing on y-axis or x-axis? It is y-axis. Okay? Non-competitive inhibition, remember, no Km is increasing. So Km is unchanged. So what changes? The other one, Vmax, changes. What happens to Vmax? Vmax is already maximum, so it cannot increase. The Vmax decreases, right? It decreases the Vmax. Km is unchanged. Okay? So when you have the Lineweaver-Burke plot for non-competitive, what shape is it? Remember, when I write non ka N, it has a ulta V and a seedha V. It is VV. So what shape does it give? It gives a V-shaped plot. Okay, it gives a V-shaped plot like this, is non-competitive. Is this clear with everyone? और unparallel इधर नहीं आता है, ठीक है? कहाँ आता है parallel? Uncompetitive. Remember, uncompetitive, when you write U, it has this two parallel lines. So when you have two parallel lines, it is uncompetitive. ठीक है? Clear with everyone? Right? Going to galactosemia. What comes to your mind first when you read about galactosemia? What clinical presentation in the question is very, very important? Cataract. What cataract is it? Sunflower cataract, snowflake wala cataract, rosette cataract, or which other cataract? Remember, galactosemia is oil drop cataract. Okay, oil drop cataract. Why does the cataract occur here? It's because of the accumulation of what compound? Remember the alcohol form, which is galactitol, which is because of the enzyme aldose reductase, which is producing galactitol. So in galactosemia, what enzyme is deficient? Remember, it is Gali-put. Galactose 1-phosphate uridyl transferase. It is not galactose 6-phosphate, but remember, it is 1-phosphate. So remember the short form Gali-put. So I tells you it is galactose 1-phosphate. Okay? Right? Again, I have not discussed essential fructoseuria, hereditary fructose intolerance, all of that here. Again, that has been discussed in short course on MedSynapse app. Okay? Going to the most important topic in biochemistry. Every exam will have a question on this topic, the vitamins and the minerals. Very, 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 very important. Okay? So, what vitamin basically causes wernicase encephalopathy? Remember, wernicase is one nicase. When I say wernicase, one. So, remember, it is vitamin B1, that is thymine. Okay, it is vitamin B1, that is thymine. Is this clear with everyone? Yes? Correct. It's vitamin B1. Okay. So vitamin B1 is required for transketolase, even pyruvate dehydrogenase. Remember, again, we have learned tender loving care for ninjas. TLCFN is a mnemonic for the three enzymes which require this: pyruvate dehydrogenase, alpha ketoglutarate dehydrogenase, and BCKD. Okay. So the B1 deficiency is confirmed by what test? RBC, what enzyme test? Remember, it's required for transketolase. So you have this transketolase test. Okay, transketolase test, very, very important, is for vitamin B1 deficiency. What is the triad in Wernicke's? Remember, Wernicke's is GOA. Global confusion, ophthalmoplegia and ataxia. Confusion, ataxia and ophthalmoplegia is given as nystagmus in the question. Okay? Going to next one. What vitamin is this? Which causes corneal neovascularization? Corneal neovascularization. Remember, neovessels are the red vessels. So, red vessels in the cornea, red tongue. Remember, red is rubro. Rubro is riboflavin. Ribo is rubro. Red cornea, red tongue. So, remember, this is riboflavin, which is vitamin B2. Remember, flavin. Flavin is your FMN, FAD, FF, flavin. Okay. And what test do you do for riboflavin then? Remember, RIRI. Riboflavin, RIRI. You have reductase test. What reductase? Glutathione reductase test. Okay, glutathione reductase test. Okay. Reductase is for riboflavin. Ribo is rubro, red cornea, red tongue. Okay, FMN, FAD. Okay. Going to B3, which is niacin. Remember, the deficiency of which causes pellagra, the 4Ds: diarrhea, dermatitis, dementia, and death. Classical image-based question in pellagra is what? The dermatitis. Casal's necklace. Okay, Casal's necklace is pellagra. So remember that this B3 deficiency can occur in what syndrome and what other disease? What syndrome and what disease can cause this B3 deficiency? Because we have learned that B3 comes from tryptophan. Tryptophan forms serotonin also. So if there's a lot of serotonin in the body, all tryptophan going to serotonin, B3 deficiency hoga. So that is going to be what? Carcinoid syndrome. Okay, that's carcinoid syndrome. And what disease? That is Hart-Nup disease, where there's a problem with the reabsorption of tryptophan. So Hart-Nup disease that can present with pellagra. Remember, niacin ka dusra use kya hai? It's a hypolipidemic drug. So niacin, remember, has niacin, has nice effect. It increases the nice cholesterol, that is HDL cholesterol. It increases the HDL cholesterol, decreases the VLDL. But remember, the side effect, it can cause flushing. And this flushing is mediated by histamine or prostaglandin. It is prostaglandin. And that is why it can be prevented by giving what? By giving aspirin, right? NSAIDs, blocking the prostaglandin. And very important, it can precipitate gout as well. So if they give you a patient on hypolipidemic drug now has this gout ke features, you think of niacin. Okay? Very, very important. Going to next one. What is the cofactor for ALA synthase? Can somebody tell me where do you read about ALA synthase? Is what cycle? Rate limiting enzyme, ALA synthase. Yes. Where did I lose the chat? Yes, very good, Dhanush. The side effects of niacin toxicity. Remember, B3, M3, maize खाने से होता है, macular edema करता है. Correct. Very good. ALA synthase is for heme synthesis. Okay, that is for heme synthesis. So remember, when there is this vitamin deficiency, it interferes with the heme synthesis and it causes anemia. So remember, what is for heme? This is vitamin B6, pyridoxal phosphate. Okay. So what drug comes to your mind when we talk about pyridoxine deficiency? Remember isoniazid, INH, TB drug. So it causes deficiency mein there is peripheral neuropathy and anemia. What anemia? Remember B6 SISI. It causes sideroblastic anemia. Okay, it causes sideroblastic anemia where you will see sideroblast. Okay, where you will see sideroblast. Is this clear with everyone? Also remember pyridoxal phosphate is required for which other reaction? Transamination. It's also required for transamination. ठीक है, ट्रांसएमिनेशन में कौन सा अमीनो एसिड कौन सा प्रोडक्ट बनाता है ये सब हमने डिस्कस किया है शॉर्ट में. सो प्लीज रिवाइज फ्रॉम देयर. गोइंग टू नेक्स्ट वन, व्हाट इज दिस विटामिन? रॉ एग वाइट खाने से इसकी डेफिशिएंसी होती है. रॉ एग वाइट खाने से इसकी डेफिशिएंसी होती है. इट इज बायोटीन विच इज विटामिन B7. सो रिमेंबर दिस बायोटीन is the cofactor for B के बाद यहाँ पे आता है C, that is carboxylation reactions. ठीक है, acetyl CoA carboxylase, propionyl CoA carboxylase, pyruvate carboxylase that requires biotin. So its absorption is blocked by what compound present in raw egg white? It is avidin. Okay, avidin prevents biotin का absorption. Pantothenic acid nahi hai. Remember, panto is penta B5. What do you have with panto? Remember, pants we wear in the feet. So you have burning feet syndrome with pantothenic acid deficiency. ठीक है, और pantothenic acid में आता है CoA, coenzyme A वाला. Going to next one, logically thinking, what vitamin has cobalt? So remember, methyl cobalamine, hydroxycobalamine. So remember, logically this is vitamin B12 cobalamine. So cobalt इसमें present होगा. ठीक है, it binds to intrinsic factor. Intrinsic factor कहाँ से आता है? कहाँ से आता है ये intrinsic factor? From the stomach. What cells of the stomach get this intrinsic factor? Remember B12 deficiency, it causes this pernicious anemia. जब auto antibodies बनती है against per is per, that is parietal cell, because this parietal cell is what produces intrinsic factor. And that is why if the patient undergoes gastrectomy, intrinsic factor gone, there can be B12 deficiency. ठीक है, so where is this B12 absorbed? B12 is absorbed in the ileum, not in the jejunum, where majority of the other absorption occurs. ठीक है, remember in the ileum you have two B's. You have a B12 and bile acids. So deficiency causes macrocytic anemia, very very important neurological manifestation, SACD. And what compound classically increases with B12 deficiency? What is the test you do for B12 deficiency? Yes? What increases? It is MMA. Remember methyl malonic acid with methyl cobalamine deficiency. It is increased MMA. Very, very important. Methyl malonic acid classically increases with B12. Okay, is this clear with everyone? We have read about folate and B12. What is similar? What is different? How do you differentiate? Both have raised homocysteine, but only B12 deficiency has increased methyl malonic acid. Going to next one, minerals. What is the cofactor for glutathione peroxidase? Remember glutathione, thigh, perfect. किसके है perfect, beautiful thighs? Selena Gomez. So remember Selena. So it is selenium, glutathione peroxidase. Deficiency causes what disease? The cardiomyopathy with selenium deficiency, that is called as what disease? That is called as Cation's disease. Okay, that is called as Cation's disease. What mineral is the cofactor for carbonic anhydrase? Carbonic rhyming with zinc, NiCinC. So remember it is zinc. Zinc is also like the alcohol gin. Remember zinc is zinc. That is alcohol dehydrogenase and also carboxypeptidase. Okay, so Zin is gin, that is alcohol, and C for carboxypeptidase. Copper accumulates in what condition? Wilson disease. Wilson disease, remember, is autosomal recessive. The story mnemonic, Shy Wilson going to seaside, autosomal recessive. On what chromosome do you have the gene for Wilson? Remember, it is chromosome 13. 13-year-old Wilson Patau's Burkha. So Wilson Patau's Burkha 2, that's on chromosome 13. So in Wilson, how is the ceruloplasmin level? The ceruloplasmin level is low, the copper is high. The gold standard test is liver biopsy. Very, very important, you have KF rings in the cornea, decimate membrane में deposit होता है. And what sign do you have on MRI in Wilson's disease? Yes? Remember, Wilson has a face like giant panda. So face of giant panda sign is seen in Wilson's. Face of giant panda is Wilson's. Correct. The gene is the ATP7B. Remember, B for beta, B for Wilson. Son is beta. So ATP7B is Wilson's. ATP7A is Menkes disease. Okay? Done with this. If this is clear with everyone, give me a quick thumbs up, guys. So very, very important topic, vitamins and minerals. इसमें से question आना ही आना है. More important points, more mnemonics on this topic have been discussed in Sure Shot, right? If you watch Biochemistry Sure Shot from MedSynapse app, definitely you'll get majority of the questions in biochemistry right. It's just 4 hours, 3 to 4 hours ka video, but it covers the major stuff in biochemistry. Yes. Done with this? Where is the live chat? Great. Going to very important glycogen storage diseases. Very, very important. One question from here again. So one Gerke's, remember one is one. It is type 1 glycogen storage disorder where you have deficiency of what enzyme? Is it G6PD, glucose 6-phosphate dehydrogenase, or it is glucose 6-phosphatase? Remember, it is glucose 6-phosphatase, not G6PD. G6PD is for HMP shunt, rate limiting there. So remember, in von Gerke's, everything has one. Everything has one except glucose. That means everything else is high. There is hyperuricemia, lactic acid increased, right? Ketones are increased. Everything is increased except hypoglycemia. And that too, hypoglycemia is very severe. So, एकदम extreme है. बाकी सब बहुत high है, glucose बहुत low है. And there is hepatomegaly, renomegaly, doll-like facies, right? All this is increased because of the depositions. What is this glycogen storage disorder which has heart failure? Remember that heart is the pump in the body. It is affected in Pompey's disease, which is type 2 glycogen storage disorder. Remember Pompey's heart uses fatty acids wala, to yaad rakhna acid maltase, which is present in lysosome. Remember lysosomes have acidic pH, acid maltase. ठीक है, तो ये लाइसोसोमल स्टोरेज डिसऑर्डर है, ओनली ग्लाइकोजन स्टोरेज डिसऑर्डर. Is this clear with everyone? So it is alpha 1,4 glucosidase, alpha glucosidase. We'll see that beta glucosidase is Gaucher's. Okay. Going to next one, and which one do you have the muscle glycogen phosphorylase deficiency? And that is why there are muscular symptoms like cramps, myoglobinuria, but there is no increase in lactate during exercise. Remember M for M. It is McArdle's. McArdle's has this muscle glycogen phosphorylase deficiency. And what classical phenomenon do you have here? Second wind phenomenon. Second wind phenomenon. Patient exercise करता है, थक जाता है, फिर वापस थोड़ी energy आती है, and the patient can exercise again. Okay, normal lactate, important, correct. Right, others that you have like Corey's, then Anderson's, Taroi's, uske tricks again in Sure Shot. Right, Anderson dies at some age, right? Cory's debranching deficiency, Anderson branching deficiency, Taroi's is tone RBCs, phosphofructokinase deficiency. All of that has been discussed there. Okay. Going to lysosomal storage disorder, which is the hexosaminidase deficiency. Remember, hexos, X is Tay-Sachs. That is how you write Tay-Sachs. So remember, it is Tay-Sachs, which is hexosaminidase deficiency, which is what gangliosidosis? Tay-Sachs. Tay is 2. That is, remember, it is GM2. Even this has been asked in the exam. So remember, in Tay-Sachs, there is exaggerated startle reflex, TATA, Tay-Sachs. Okay. What is the appearance of the lysosomes? Tay-Sac. Imagine it's like a sack, a bora, a pota of onion, right? Onion ka pura sack. So there is onion peel lysosomes. Do you have cherry red spot? Yes. Right? So remember, for cherry red, it is made up of 2 words. So lysosomal storage made up of 2 words. Tay-Sachs, Niemann-Pick's. They have cherry red. How do you differentiate? Tay-Sachs is tiny organs, no hepatosplenomegaly, T for T. Niemann-Pick is big. There is hepatosplenomegaly present. Okay. So it is distinct from Niemann-Pick's because it has no hepatosplenomegaly in Tay-Sachs. Tiny organs, no hepatosplenomegaly. Very, very important. Which is the sphingomyelinase deficiency? Sphingomyelinase. Remember, NIP. Reverse में अगर आप पढ़ोगे sphingo, it is Niemann-Pick's. Okay, it is Niemann-Pick's, which is sphingomyelinase. So imagine a Niemann, a man Niemann crossing the zebra crossing. So what bodies it has? Zebra bodies. Crossing the zebra crossing and putting the finger in the nose. Finger is the sphinger. And what is coming out from the nose? Remember that dirty foam coming out from the nose. Okay, so foam cells, zebra bodies is finger, Niemann. Again, it has cherry red spot, but with hepatosplenomegaly. Big, big organs in Niemann-Pick. Big is pick. That's how you remember. Okay? Next one, Gaucher's. Gaucher's is what enzyme deficiency? Glucosidase or galactosidase? Gaucher's is glucosidase or galactosidase? Remember, Gaucher's important. U is what you have to remember. It is glucosidase. What glucosidase? Beta glucosidase. Okay, glucosidase or glucocerebrosidase. ठीक है, बीटा है, अल्फा नहीं. अल्फा इज इन पॉम्पीज. ठीक है, जो अल्फा हमने देखा ग्लूकोसिडेज अभी. So this is the most common sign is lipid laden macrophages with what appearance? Remember, Gaucher's ka patient comes with ouch, ouch, a lot of pain. So the doctor gives tissue paper to wipe the tears. So remember, paper appearance, tissue paper, right? That is a crumpled paper appearance is what you get in Gaucher's. Ouch, ouch, patient crying, give the paper. Crumpled tissue appearance. करेक्ट. पैनसाइटोपिनिया होता है, बोन्स अफेक्ट होते हैं. तो फीमर में कौन सी डिफॉर्मिटी होती है? अर्लिन मेयर फ्लास्क डिफॉर्मिटी. ओके, अर्लिन मेयर फ्लास्क डिफॉर्मिटी. इज दिस क्लियर विथ एवरीवन? Plus, very important, there is pancytopenia which is present. So anemia is commonly given. Anemia with bone pain is commonly given in Gaucher's ka question. Okay. Going to MPS, Hurler's, Hunter's wala. What MPS is? Iduronate sulfatase deficiency, Hurler's or Hunter's? Is it Hurler's or Hunter's? Thank you so much, Ash. Remember, iduronate sulfatase, TT, is going to be TT Hunter's. Okay, so that is Hunter syndrome. Iduronate sulfatase. Hunter requires a clear cornea, right? Hunting ke liye the vision should be good. So very, very important, there is no corneal clouding in Hunter's. Remember, both Hurler's and Hunter's MPS, but Hunter's does not have a corneal clouding. Hurler is L. It is L iduronidase deficiency. Hunter's is iduronate sulfatase, TT. Okay? Clear with everyone? What accumulates? The various tricks for all the mucopolysaccharidosis, glycosaminoglycans, unka structure, all that is there in the MedSynapse app. Very good. Hunters is what inheritance? Autosomal or X-linked? Remember, it is X-linked recessive. So remember that hunter hunts with an axe. So it is X-linked recessive. Hurlers, autosomal recessive. Majority of your metabolic disorders are autosomal recessive, but remember, hunter is X-linked. What else is X-linked is Fabry's. Remember, Fabry's like fabrics, X-linked recessive. Okay? Clear with everyone? Done with that, coming to the last part for the today's session. Please revise this biochemistry session. Even if you are not there on MedSynapse app, at least itna revise karna before the exam. Whether it's for FMG exam or for NEET PG exam, this is very, very important. For pyrimidine synthesis, which CPS enzyme is the rate limiting? Remember, pyrimidine is di, which is CPS2. CPS2 is the rate limiting. Okay, di 2. And we have seen that CPS1 is the rate limiting for urea. Okay, that is for urea. And 1 is a mighty number. It is mitochondria. This one is cytosol. Okay, this one is cytosol. Remember, all the synthesis occurring in cytosol. Okay. A defect in UMP synthase causes, so there is accumulation of orotic acid. So the condition is orotic acid urea. Very, very important. Remember, orotic acid urea will have what anemia as a feature? Yes, what anemia will be the feature there? It is megaloblastic anemia. So when the patient has megaloblastic anemia not responding to B12, right, you will consider this orotic acid urea. You need to supplement. अगर UMP synthase है तो uridine वो हमको supplement करना पड़ता है. In the treatment you give uridine there. Okay, clear with everyone? Right? Correct. In which vitamin deficiency did we see sideroblastic anemia? Remember, C, sidero is 6, vitamin B6 deficiency. Okay. All of you will let me know in the comments that which poisoning can have sideroblastic anemia. Okay. Right. Going to next one, purine. So what is this syndrome? Classically, where you will see this self-mutilating behavior, lip finger biting. Self-mutilating behavior is Lesch-Nyhan syndrome. Very, very important. Lesch-Nyhan syndrome is caused by complete absence, not just deficiency, but complete absence of what enzyme? HGPRTase. Which is the enzyme in what pathway? Purine. What pathway? De novo synthesis or the salvage pathway. Remember, this is salvage pathway, not the de novo synthesis, right? So classically, remember, purine wala is uric acid. So यहाँ पे uric acid बढ़ जाएगा, hyperuricemia होगा, तो हम allopurinol दे सकते हैं. Patient में severe aggression होता है और होता है self mutilating behavior. ठीक है? Coming to blotting techniques. What is a mnemonic for blotting techniques? Remember, it is snow drop. Southern for DNA, northern for RNA. This is 0, 0, null. Western is for proteins. So remember, RNA, R is N, northern blotting. DNA, D is S, southern blotting is for DNA. Proteins, P is western blotting, snow drop. And DNA binding proteins like transcription factor. Remember, DNA और proteins दोनों चाहिए. So DNA भी चाहिए, proteins भी चाहिए. तो कौन सा वाला रहेगा? South western blotting technique is for DNA binding proteins like transcription factors. ठीक है? Again, let me know in the comments that what is the eastern blotting for? Okay, eastern blotting is for what? Right? Clear with everyone? So that was about the today's session. I would highly recommend that if not anything else, but at least watch the Biochemistry Complete Sure Shot from the Sure Shot course in MedSynapse app. You will be very much sorted with biochemistry. So if you are afraid of biochemistry or pharmacology, microbiology, right? So definitely you should watch the Sure Shot sessions in the MedSynapse app. The details of the MedSynapse app and various subscriptions are given here, right? The PDF, both blank and annotated, is attached in the free course on MedSynapse app Sure Shot Sprint, the link of which is pinned here in the live chat. Okay? Clear with everyone? What session do we have tomorrow? Tomorrow we have FMT KBMD. KBMD is Kaun Banega MD in MedSynapse app live class for the subscribers. In Kaun Banega MD, basically you have questions on your screen and you answer it then and there like it happens in KBC. So that's like your real exam hall pressure wala actual situation. You get a leaderboard also, right? So the MedSynapse subscribers, please make sure to attend the FMT KBMD tomorrow. We'll do it tomorrow afternoon itself. The session is going to be at 1:30 p.m. tomorrow for FMT KBMD. Okay? All right. So yes, Ash, definitely I would love to meet you as well, and the schedule for the live classes. I update in every live class, the next live class ka schedule. Okay. All right. Thank you so much, everyone, for joining in. Please do revise it and do not forget to give that mini test on this topics that we have discussed. You can give it immediately after the session now if you have not given before. Again, the test is live in the sprint course, the Sure Shot sprint course, the free course on the app. Okay. Thank you. Goodbye. Take care and keep studying, keep revising, keep med synapsing and keep winning. Thank you.